ChatGerry Health as My Life Operating System, number 1552, February 27, 2026. Gerald C. EclaireMD Foundation, Category General. A lifelong system, not a post-stroke reaction. Some people think that after my stroke I must be living in tension, watching numbers all day and worrying about the next event. The truth is the opposite. What I do today is the same pattern I have followed for more than 60 years. My field has changed from naval ships, aerospace, semiconductors, and business systems to the human body, but the operating method has never changed. When I was young, I spent 18 years studying many disciplines, from mathematics and engineering to business and economics. Later, after retiring from Silicon Valley because of my heart disease, I spent another period of my life studying psychology and medical science. In total, 44 years of formal and self-directed learning built the same habit: observe the system, understand the variables, and keep the process running in real time. During my entrepreneurial years, I survived 7 failed startups before one success. In those years, I learned something more important than technology. Survival depends on continuous feedback and immediate adjustment. A system collapses not because of its average condition, but because of a critical moment when load exceeds structural tolerance. That lesson is now applied to my body. Health as a real-time operating system. Today I measure my blood pressure and heart rate more than 20 times a day. From these values I immediately know my pulse pressure, mean arterial pressure, SBP spike, and my stroke triggering sensitivity index TSI. This sounds intense to some people, but to me it is as natural as breathing or walking. It requires almost no mental effort because it has become a lifelong habit. I do not wait for a lab test. I do not wait for a clinic visit. I see my quantitative risk levels on my iPhone in real time and make a small adjustment when necessary. Then the system returns to balance. A stroke is not caused by a long-term average. It happens in a single moment when vascular stress exceeds structural capacity. My method is designed to detect that moment and act immediately. I am no longer a passive patient. I am the operator of my own pathophysiology. Continuity creates productivity. Over the past 8 years and 2 months I have written 1550 single-author medical papers, about one every 1.9 days. This speed does not come from working faster or harder. It comes from living inside a continuous system. My daily life generates data. The data produces analysis. The analysis returns to daily life as action. This closed feedback loop removes fragmentation and creates creativity. A surgeon repeats a fixed procedure to avoid variation and protect life in a critical moment. My research does the opposite. It uses creativity to enter uncertainty and uncover hidden mechanisms. The research method stays the same, but the content keeps evolving. That is how my viscoplast topology model VPT was born. By combining time-dependent behavior, permanent structural damage, and the moving trajectory of diseases, I can see what traditional snapshot medicine cannot see. I am not interested in the debate of n=1 versus n=many. I am interested in the transfer function of health, how specific lifestyle inputs produce specific biological outputs. That relationship exists whether the sample size is 1 patient or 1 million patients. The underlying scientific truth never changes. Why I now speak directly to patients. After publishing more than 1,000 academic papers, I shifted my focus. My true audience is not the medical system. It is the patient. Patients need something simple and practical. What is happening inside the body? Why it is happening to me? What I can do today? My own life proves that long-term metabolic damage can be reduced, but structural limits still exist. That is why real-time control of hemodynamic stress has become my life-saving tool after the stroke. My life is now guided by one goal: longevity with function and clarity. Health is no longer something I manage. It is the operating system that carries my life forward. Nothing in my past was wasted. Mathematics, engineering, AI algorithm, semiconductor business, life failures, mortality, diseases, and health recovery are now one continuous system moving in the same direction. At age 79. What matters more than happiness, health, and longevity? Disclaimer: I write this paper not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.